I'd like to introduce our presenter for tonight, Dr. Azlen Theobald. This is Dr. Theobald's second webinar with us. Her previous webinar on improving social outcomes for children with Tourette syndrome and other neurological disorders is available for download on our website. Dr. Theobald completed her doctoral degree in clinical psychology at LaSalle University in Philadelphia with a concentration in child and family psychology. She also completed an American Psychological Association accredited internship at Terry Children's Psychiatric Center in Newcastle, Delaware, and has also trained at Children's Hospital of Philadelphia. She specializes in improving neuropsychological evaluations she specializes in providing neuropsychological evaluations for various populations across the lifespan, from toddlers to older adults. Her areas of expertise and specialization include attention deficit hyperactivity disorder, autism spectrum disorder, Tourette syndrome, traumatic brain injury, and dementia. Dr. Theobald received specialized training in executive function skills for children and adolescents and is formally trained on the Autism Diagnostic Observation Schedule. She has presented research on the family impact of neurodevelopmental disorders, including autism and Tourette syndrome. Dr. Theobald, it's a pleasure to have you back. And now, without further introduction, I'll be happy to turn tonight's program over to you.
Thank you so much, Marty and Kelly. And to Marty, it's been a pleasure getting to know you and work with you only these past couple of months, but I wish you all the best in your retirement with good health and happiness. So here we are tonight to talk about parental burnout in the face of COVID-19, which is what the title slide says. And I'm sure we're going to get into parental burnout, and I'm sure there'll be a lot of questions at the end about burnout and, maybe some even more specific questions about burnout in families where you're dealing with a specific issue or child behavior issue or mental health disorder or neurodevelopmental disorder. So I'll try and leave a lot of time at the end so we can answer some questions. And I give that with the caveat that I may not have all of the answers, but maybe together we can kind of collaborate and come to some consensus of some positive direction where we can move forward. So the idea of burnout is kind of novel. It feels like we've been living it for years now, even though it's been a couple of months that we've been facing the pandemic. But the idea of burnout was originally, it was used as a term within the workplace. It came about to be more mainstreamed in the early 2000s, around 2004, when a group of researchers were looking into job burnout, and they questioned whether or not burnout was restricted to one's work. And these researchers determined that anyone who was doing something meaningful that was also enduring conditions of chronic stress was experiencing burnout. So after some research, they did in fact find that parents can burn out. And I was just wanting to start off on a little bit of a light note that I was thinking the other day of I was looking at my business card and handing it to a parent, and I kind of laughed to myself because I thought, well, okay, so this is one job title, but if we were all to kind of look at our collective job titles that very suddenly came upon us back in somewhere around mid-March, I think our business cards would be like the size of an 8.5 by 11 piece of paper and would say things like parent, teacher, support person, coach, therapist, house cleaner, chef, entertainer, and your actual real job that parents have been trying to maintain and hold down these many months. I applaud all the parents who have hunkered down and have really done Herculean efforts to try and get their kids through the end of the school year. I applaud the teachers and all of the support staff who have really gone above and beyond. Maybe some people had some contingency plans for something sort of like this, but nothing exact. And, we all kind of adapted very, very fast. And most of us without any training on how to do it. I'm trained to kind of work with children, but I have 3 kids of my own, and it was really, really hard, and it still is really hard. So I empathize with all of you out there, but I wanted to start out with a little bit of levity And one quick story, the house cleaner bullet on this slide. The outset of all of this with the pandemic, I kind of said, all right, here's all the things we're going to do as a family, and we're going to have this schedule, and this child is going to be in charge of this bathroom. So trying to model how to clean a bathroom for a 9-year-old. And what I didn't quite model, I omitted the part about not mixing certain toxic chemicals like bleach and oh, I forget what it was, some other kind of house cleaner. So we all had to evacuate our house for a couple hours because we had toxic gas going on in the house. So that was, my effort. But I'm sure all of us have lots of stories that maybe some of you will be wanting to share at the end. So what is burnout? It's the data has suggested that there are 4 main components of burnout. So it's really an exhaustion syndrome characterized by the following. So it's feeling exhausted by the parental role, kind of unable and feeling really overwhelmed by basic parenting tasks. Feeling like there is some contrast with the parent you kind of were, so the me now is not as competent as the me then, and not being as fulfilled in your role now as your role then. So there's kind of this physical and emotional exhaustion. There's this feeling like you're emotionally distancing from your children. So feeling kind of fed up with the parental role, feeling very frustrated with the tasks of parenting. And when you're feeling this emotional distancing from your children, also feeling disconnected. So it's not really numbness, but it's just kind of feeling like a lull of emotion toward your kids. So you just kind of recap those. It's being exhausted by the parental role, feeling like there is a contrast with kind of the parent you were and the parent you now are, and not being as fulfilled in your role now as your role then. So we could call that maybe pre-March, maybe February. Feeling fed up with the parental role, being really frustrated with the task of parenting, and this kind of sense of being disconnected from your children. And it's different than job burnout. It absolutely, because it's contextual. It's very specific to the parenting context and the parenting tasks. Can you have both job burnout and parent burnout at the same time? Absolutely, yes, 100%, and probably most of us do. And there's some small to moderate correlation between having job burnout and having burnout in other areas of your life. So because what burnout is, it's sort of a response that you're having to conditions of chronic stress that are really beyond your current capacity to cope. So it's definitely not outside the realm of possibility that you may have burnout in multiple environments. And the thing is, parents aren't supposed to be able to burn out. We're taught both explicitly and implicitly from information we get externally, as well as from what we come from our own identities, from our own knowledge, from our own experiences, maybe how we were parented. That parenting is this ultra rewarding, fulfilling, and so wonderful that one smile from your beloved child will instantly fulfill you. And that the task is so joyful that the occasional difficulties are barely noticed. And that is just plain not true. And it's a myth that can really do some damage and be very harmful to parents. So who's at risk for this? A lot of people. When we say risk factors, I don't mean that, if you're a parent, then you're going to get burned out. That's really a causal relationship, and that's not what we're talking about. So some studies have been done on this, and I'm going to go over sort of what groups of parents or what types of parents are most at risk for being burned out. So the first one, it's that myth. It's holding yourself to this unreasonable standard, trying to be a perfect parent and get everything right all the time. And guess what? None of us ever do. So trying to hold yourself to that standard is absolutely unrealistic and can be very damaging. The second one is your temperament, your personality of a parent, kind of what you bring to the table, your organic personality. So there's a lot of variability in quote how we are, our personalities or our temperaments. Some of us are more reserved, introverted, while others are much more extroverted. Some of us struggle with an anxiety disorder or chronic worry, while others may struggle with low mood and depression. So that's a predictor of parental burnout. The parental response to stress. These are really significant predictors of whether one is more likely or less likely to feel the effects of burnout. If you're a single parent, if you don't have support and you have to shoulder the burden of the family day in and day out, that is a very significant factor in parent burnout. Parents who may have not witnessed appropriate parental modeling as a child. So through your childhood, maybe you didn't have the best experience with your parents. Those individuals are at greater risk for burnout. Or perhaps parents who don't have really well developed skills in child rearing practices. So, parents who have good skills about managing behavior, picking battles, and navigating the day-to-day challenges of child raising do tend to fare better and are able to kind of have lesser risk for parent burnout. If you're raising a child with a chronic health condition, a mental health condition, a neurodevelopmental condition, or any kind of child with special needs, even if it's a learning disability, dyslexia, any kind of special needs, that will pull more resources from you. So those parents are also more at risk because the demands are much greater on you. You need to spend more time working with your kids, which will push your other priorities on the back burner for yourself, and that includes self-care. And the last one is working from home. That is a very significant factor in increased risk for parent burnout. So I thought when I was reading that article, I thought, well, duh, isn't that most of us over these past few months? So unless you're an essential worker, in which case you're missing your kids, you're likely working long hours in grueling conditions to keep the rest of us all safe. And you have that added concern and worry of increased risk of exposure to COVID. So that group of individuals is much more likely to experience parent burnout. I wanted to talk about some consequences associated with parent burnout. So kind of what happens? What are the consequences when a parent really reaches that critical point of experiencing burnout? Again, these are associated, but not necessarily caused by parent burnout. So I just wanted to reiterate that. So the first one is mood changes. Parents who are really depleted are much greater risk for depression. There's much greater risk for issues with substance use or abuse. Disrupted sleep. If you're up multiple times a night, especially parents who have brought newborns into the world in these past couple of months, I mean, really experiencing disrupted sleep during a really difficult time. There's couples conflict that parents are at increased risk once you're kind of depleted with your partner, significant other. There's child neglect, increased risk. I'm sure many of you have heard or read lots of articles about the increased risk of physical violence in the home and domestic violence in the home as a result of everybody kind of being hunkered down in one place. And lastly, the risk of self-harm or suicidal ideation. And those are really some of the more critical consequences that are associated with parental burnout. So those consequences are pretty great. And under these current conditions, parents are at a much greater risk for having some of these consequences occur. So it's really important to be vigilant, kind of monitor yourself, check in with yourself, and see how you're doing as a parent. And as an individual too, your only identity is not just being a parent. So I will talk about that momentarily. And that parenting relationship is crucial to children's psychological development. So attachment or the lack thereof can be very damaging. That's why it's so threatening to even consider the possibility that parents can burn out. But if we can't think about it, then we can't do anything to address it. And the thing is we can't give what we don't have. If we're disconnected from ourselves, we can't give the 3 critical things that children need: attachment, love, and nurturing. If we're under stress, we can't always respond with patience and model that compassionate caring in the face of challenges. And since for parents, it's really up to the parent to know when that's happening, when burnout is reaching critical levels, when that tilt is flashing, when the red alarms are going off, and to know what to do about it. And that problem is particularly severe when parenting a challenging child. In our practice at NeurAbilities, we treat we work with parents and families of children with neurodevelopmental diagnoses and neurological disorders. So when you're parenting a child whose presenting problem is anxiety, obsessive compulsive disorder, attention deficits, depression, or an autism spectrum disorder, the potential for burnout is so much higher. Some of the physiological effects of stress are pretty numerous. So in times of stress, one's thinking can become really confused and distorted. You know, I have seen lots of people, I myself have noticed that I'm a little bit more repetitive. I question whether I told someone something. I start sentences a lot of the times with, forgive me if I told you this already, but I'm writing a lot more things down. So, you know, I'm really trying to kind of boost my organizational skills a little bit more, because I myself have been more stressed and have experienced more stress. So I've noticed that my thinking is becoming a little bit not as ideal or not as good as it was before March. Short-term memory can also become quite impaired when stress levels drastically increase. And a couple other physiological effects. So blood pressure can rise, headaches can become more frequent or more intense, or both. Judgment becomes a bit more impaired. There's appetite changes, whether appetite notably increases if you're more an emotional eater, or appetite decreases because the stress, just depending on how you respond to stress, some people just don't want to eat. They feel that their stomach's kind of in knots, so that appetite is reduced. And there's gastrointestinal changes as well. So you just can't do all of this on a low battery. And like I said before, but parents of kids who are maybe not necessarily neurotypical are really struggling. The effects alone of kids who were getting services in school, that all had to shift to some type of online format. So I've heard, you know, some people were able to do it really, really well and deliver that service in an online format quite well. Other people didn't have the same positive experiences. So, you know, it really was kind of maybe even down to clinician specific of how those services were being delivered. Some services, if you were getting speech therapy as part of an IEP in your school, maybe that was reduced in how the frequency, kind of the dose of the therapy that you were able to get for numerous factors. So, you know, those parents in particular had to really pick up a lot of slack. And, you know, some parents may have noticed a regression in skills and other effects of their child not being able to go to school. So again, talking about, well, there were lots of concerns. So these additional challenges included, is my child going to regress in skills? How can I get services for my child? That didn't kind of boot up immediately when school shut down. That kind of took a little while for a lot of districts, just because this was a novel situation and everybody was just trying to do their best to kind of figure all of this out. One thing I wanted to mention, that it's okay. I know most schools are finished for the school year, but it's okay to reach out to your case manager on your child, on the child study team at your child's school, and ask for support. What kind of things are available for my child this summer? What kind of resources can you provide me with for the summer months? Because, you know, even though school ended, a lot of parents feel kind of like, I already had summer vacation, and it's only mid-June. So what are we going to do for the rest of the summer? I know my children's camps are all canceled for the summer, so they're all home. And I'm sure a lot of you out there experience the same thing. So it's okay to ask for support from your providers and from your child's treatment team to see what is available for the summer, even, you know, books and other resources, other online resources, to try and keep your child as afloat as possible and reduce that risk of regression in skills. It was also a time, these past couple of months and these coming months of the summer, where we could focus on other types of learning. So life skills development, particularly for kids with intellectual disabilities, or kids with autism, with a you know, language disorder, with intellectual disabilities as well. Focusing on that life skill development, really honing in on hygiene and showering and teeth brushing, learning how to, make something really simple, a simple meal, learning how to kind of care for themselves a little bit more. This is a really good time to do it. And I've seen some really wonderful stories out there of what kids are able to learn at home. And I can't say this one enough. I'm sure everybody's exhausted with hearing it, but really keeping schedules and routines as consistent as possible to set your family up for success. And I'll elaborate on that in a moment. So how to manage parental burnout. So if you're a parent, I just want you to start where you are. And what does that mean? So that means take a moment, hit the pause button on your current moment, and let yourself really acknowledge how difficult these times are. So many of us in the mental health community have noticed that some days are just better than others, and that the emotions kind of come in waves. So there's this period of feeling like, okay, things are going to open soon, and then we hear that there's another wave coming, and hearing there's increases in COVID cases after recent large gatherings all over our country. So it's really important to acknowledge that communities that are also living in poverty and communities of color are experiencing much more significant consequences of the COVID crisis than those of us who are not in those communities. So while we may say we're all in this together, we are truly experiencing our own struggles in varying ways that are not the same as everyone else's. I want you to let yourself off the hook. And when like I said in the beginning, when I first got word that things would be shutting down, I made this whole list of things I wanted to get done. And, in reality, how many of those things I actually accomplished? Maybe 2 or 3. So I had felt like I failed, and I saw some pretty funny memes on this exact sentiment. So, but then I realized, you know what? It's okay that I don't cross everything on my to-do list. That is totally okay. Create your own support group. Many of you may have already done this. Create a support group of peers, coworkers, friends, family, who can really be around you. You should not do this alone. And if you feel isolated, there's many agencies speaking to this exact practice of coping during the COVID crisis. And the other way that you can do this is realize that you're not alone in any way in your feelings of being overwhelmed either. So reaching out to others, that's probably going to show you that many parents are struggling in exactly the same ways. Stop and breathe. You do need downtime, whether that's finding some space at the end of the night when everyone else has gone to bed, or carving out a couple of moments throughout the day just to stop and check in with yourself to see how you're doing. I want you to take breaks, scheduled breaks. Set the alarm on your phone for every hour. Just get up for 2 minutes and take a walk. There were some days where I didn't get up from my chair for 3 or 4 hours, and my legs were asleep, and the last 20 minutes of whatever work I did was really not of the best quality. So really taking breaks can kind of recharge you mentally. Excuse me. Get enough sleep. You have to nourish your body. Limiting nicotine and alcohol, that can tend to increase grogginess the next day and really wind up shortening your fuse. So you're not going to be able to tolerate as much or demonstrate as much patience. The next one is mindfulness. So this is a tough one to do, but really honing in on your mood, your thoughts, and your emotions is a better strategy than avoiding your emotions. When I was in grad school, we had this ubiquitous analogy of take a blown up beach ball and try to push it under water. Like maybe take a beach ball, put it in a swimming pool, and try to submerge it underwater. It won't stay submerged when you let go. It always bounces back up. So that's what it's like when we try to suppress our emotions, when we try to avoid them. They always come back. The 5, 4, 3, 2, 1 technique. So that's one I really love. I use that myself. When feeling overwhelmed, you have to pay attention and really try to engage your 5 senses. So this simple exercise of focusing on 5 things, and kids really love doing this. You can do this together as a family. You have a child who has a pretty low frustration tolerance. This is an excellent strategy to get them to begin practicing and using and implementing in many different settings: school, out with friends, at home. So you focus on 5 things you can see, 4 things you can hear. So maybe you hear the birds, you hear a lawnmower, you hear your kids. 3 things you can smell. So it could be the cut grass, it could be the paper on your desk, could be the coffee cup next to you. 2 things you can taste, maybe your toothpaste from the morning, or maybe the coffee you're drinking, and 1 thing you can touch. And that practice pauses your brain in the reaction process of stress And it really allows your mind to focus on something else, even if it's just for brief moments. I really like that one. Try to manage temper outbursts. So that's easier said than done. So there's this distinction between feeling anger and how you respond to it. So it is absolutely okay and normal to feel what you're feeling and think what you're thinking. If you lose your temper, you may tend to react by feeling shameful or embarrassed, and that can cause additional stress to your situation. So really let yourself off the hook when feeling and thinking in angry ways, but just to reiterate that it's not okay to engage in violence or physical discipline. Step back from your thoughts. So think for a moment about a thought you have that you find unacceptable or unwanted. So for example, you may be having the thought, I'm a terrible parent. So just notice the process of your thinking and tell yourself, okay, so I'm having the thought that I'm a terrible parent. I'm having the thought that I just want to run away right now. So all you're doing is noticing the thought and commenting on it, but you're not becoming the thought. It doesn't make the thought go away, no, but you can step back from them, and it allows you to kind of externalize the thought and kind of put it kind of away from you. And that helps to change your reaction to the thought and allows you to choose how you react to these thoughts. The next one is ask yourself, just slow down and ask yourself, what do I need right now? In this moment, do you need to get away from some noise? Do you need to step outside and breathe some fresh air? Are you hungry? So see if you can check in with yourself and allow yourself one really nice act of kindness and loving compassion at least once a day. And that is really hard for parents to do. We put our children's needs first. They're hungry, so they eat first. Maybe I just don't get to eat lunch today. They need to get through their homework, but I need to jump on a call for work. But okay, I guess I'll dial in late. That's okay. So if you notice that voice creeping up in your mind, try to see if you can be a little more kind to yourself, even for the moment. And this last one, do not compare yourself to other parents or families. I have somebody from my high school formed a workout support group, and it started with, maybe 50 of us, and it really grew exponentially across the country, and it was a couple thousand by when I last checked. And I would get so frustrated when I would see, oh, I ran 10 miles today. I did a Peloton class, and then I went and ran 5 miles with my kids. And I'm thinking, when are these people doing this? So I just realized, their life is different from mine, and maybe I don't have time to do that. So I'm not going to compare myself to other people. Maybe I walked a mile that day, and that was just great. And engaging in all of these actions I just discussed can help promote something called psychological flexibility. And what that really means is choosing to do what's best for you and what matters to you. It's based on the principles of acceptance and commitment therapy, or some of you may have heard it called as ACT therapy or ACT. It essentially looks at your character traits and behaviors to help you in reducing avoidant coping styles. So I don't mean indulging yourself in ways to avoid your emotions. It's really about when you're experiencing stress, just kind of stepping back, noticing your emotions, and choosing toward taking a small footstep toward where you want to be and learning how to flexibly behave in a way that serves you, that works for you, rather than works against you. And this is just a graphic. For those of you who are clinicians, you may know this. It's something called the Hexaflex. It's a fancy term for, it's really you as an individual working toward your goals, toward those values on the right side. So taking that step, what is my value? My value is I'd like to be a little healthier. So when you're faced with a choice of, am I going to eat a whole pint of ice cream, or am I working toward my value of just having a serving of ice cream? That's working toward my value, toward where I want to be, toward what I'm choosing to be. So it really helps work against people who have avoidant coping styles. And I loved this cartoon. So I think this was the feeling a lot of parents had when we heard that the shutdown of schools was coming. So at the bottom it says, your mother and I are feeling overwhelmed, so you'll have to bring yourselves up. And I think everybody's looking a little overwhelmed in that picture. So younger children have particularly suffered during this time, and they've really missed things like the playground, being social, seeing their friends, having a routine, and it's really been impactful for that younger age group in the 4 to 10 year age range. So a couple of things we can do for them, because sometimes we forget, older kids are able to express to us or physically stomp around the house or slam doors their frustration. Younger kids can do that too, but it's a lot harder for them to verbalize exactly how they're feeling and kind of have a debrief with them. So a couple of things you can do as a parent for the younger group under 10. Empathize with them. That's really first and foremost. Label what you're seeing. I see how you're feeling. You look sad. You look mad. Try not to give them advice at the start. Really try and help them, guide them to identify their emotions and how they're feeling. After that, you can then walk them through the why they're feeling that way. So it might sound something like saying to your child, if I were a pair of eyes in your brain, what thoughts would I see floating around? And you can even start the thought for them by saying, I feel like, and let them finish the thought. Or I'm mad because, or I really wish I could. Let them finish. Give them kind of a starting prompt. Let them know that what they're feeling is very real and valid and appropriate for their age. You can tell them that this is a really unusual time. It doesn't happen often, we hope, because they're all frightened that this is what every school year is going to look like, or this is what every summer is going to be for their future. So really help them label their emotions, help them understand that emotions are not permanent, they come and go, and call their attention to when their emotions change. So you notice that your child was really upset, maybe 10 minutes later, they're doing something enjoyable and you see a smile on their face, label that. Say, wow, you were really upset 10 minutes ago, and I see that that's changed. So that calls their attention so they can raise that awareness that emotions aren't permanent. You might want to make a calm down space in your house or some kind of fort with fairy lights and soft pillows where they can go to feel safe, let their emotions out, and really release some of those feelings. You can model emotions and responses to frustration for them. This is really how they learn. If you're feeling overwhelmed, you can say something like, I feel like my work is really piling up and I can't get it done until after everyone goes to bed. So that's really frustrating and I'm feeling very tired. I wish I could take a nap right now. Saying it calmly, but honestly, is letting your child know that parents can experience negative emotions too, that is normal. But how they're responding to it is the key for them to see. So a lot of us became teachers overnight, and I loved this. So teachers were really, really appreciated, again, as they should be, and should always be. Teachers do way more than teach. They are kind of the emotional regulators for our kids and the referees and the coaches, and just have just done a fantastic job. And I hope that the one benefit of this experience is that we all realize just how much teachers and educators and administrative staff really do for our kids while they're in the schools all day. So how can a parent get a break? A lot of people said, how do I get a break? How do I let my kids know I just need a minute to myself? So I like to use if-then statements. If you do this, then you can have that. So you could say to your child something like, I need 15 minutes alone. I need you to go in your room or go to your sibling's room and play quietly. If you can give me 15 minutes by myself, then we can do something fun afterwards. Kids do not understand the construct of time until a certain age. So really using timers, countdown timers are the best, because time is just this nebulous construct. If you don't think your child can handle 15 minutes, then just meet them where they are. Start at 3 minutes and shape the behavior to longer periods of time. But if you said you're going to go do something fun, you really do have to follow through. Doesn't have to be setting up a carnival in your backyard. It could be just something kind of simple, but you do have to follow through. If you have really little ones, try to keep them in your line of sight to ensure their safety, but do disengage for them for a period of time or give them an activity to keep their attention, then reward them for giving you some alone time. So kids have really been scared during this, and children rely on their parents for safety, both physical and emotional. So really reassure your children that you're there for them, that your family will get through this together. Answer questions about the pandemic simply but honestly. Talk with children about any frightening news they're hearing on TV or reading. And it's okay to say people are getting sick, but saying something like following rules like hand washing and staying home will help our family stay healthy. Recognize your child's feelings, and you can just calmly say, I see that you're upset because you can't have friends over. Guiding questions can help older children and teens really work through issues. So something like, saying to your child, I know it's disappointing not being able to hang out with your friends right now. How do we think what's the best way you can stay in touch with them? There have been a lot of social media messenger apps that kids can use kind of with a parent overseeing it for safety. So really allowing your kids some online space to continue socially connecting with their peers is really important. Keep in touch with loved ones. Children may also worry about a grandparent who's living alone or a relative or friend with an increased risk of getting COVID-19. So video chats can really help ease that anxiety. Again, modeling how you're managing feelings. I'm worried about grandma since I can't go visit her. The best I can do is to check in with her more often by phone. Let's put a reminder on the phone to call her in the morning and in the afternoon, and then we can check on her together. Tell your child when you're leaving the house for work or for essential errands. In a calm, reassuring voice, tell them where you're going, how long you think you'll be gone, when you'll return, and that you're taking steps to stay safe. I mean, this is particularly important for kids who are struggling with anxiety. And look forward with hope. Tell them that scientists are working hard to figure out how to help people who get sick and that things will get better. Keeping healthy routines is really important to limit parent burnout. So during the pandemic, it's been really more important than ever to maintain bedtime and other routines. It does create a sense of order of the day. It allows parents the knowledge to know, okay, at this time, I know I can have some downtime to myself and practice some self-care, things that you like to engage in. All children, really including teens, do benefit from routines that are predictable but flexible enough to meet individual needs at the right developmental stage. So structure the day with the usual routines that are kind of thrown off. Establish new schedules. So break up schoolwork when possible. Older children and teens can help collaborate with schedules, but they should follow a general order, something like wake up routines, getting dressed, breakfast, some kind of active play in the morning, maybe quiet play, a snack, and then transitioning into schoolwork, which again, I know most schools are done. Some families are still doing extended school year. Exercise and activity is really important to build in through your day. I talked about some online social time with friends, some joint family time, some kind of enjoyable activities, or just hanging out and watching a movie. And reading before bed is also really important. And just a word about bedtimes. Children often had more trouble with bedtime during this stressful period. So try to keep a normal nighttime routine, especially for younger children. Maybe put a family picture by their bed for extra love until the morning. Bedtimes can shift some for older children and teens, but it's a good idea to keep it in a reasonable range so their sleep-wake cycle isn't thrown off. I have heard of this vampire syndrome where kids are up much of the night and they're going to bed somewhere around 4 or 5 in the morning and sleeping a lot of the day. So that's really disruptive to them. It's disruptive to the family. When you're trying to sleep because you have to work the next day, you may hear your kids, moving around the house at 3 or 4 o'clock in the morning, and that's absolutely not ideal. Some ways you can help manage their emotions and behavior is particularly important for kids who have that lower frustration tolerance and maybe more externalizing in their emotions. So redirect that negative behavior. Sometimes kids misbehave because they're bored or they don't know what to do. So kind of finding other things for them to do that are more positive and more adaptive. Creative play. So suggest your children draw pictures of ways your family's staying safe. And really direct your attention toward positive behaviors. Reinforcing those good behaviors. It's a really powerful tool. So notice good behavior, any good behavior, even you put your shoes on without me, telling you. I think that's great. You put them on so well and quietly. If your child has ADHD and does everything, quite loudly, point that out. Point out what you see that you like that is positive. Praising success and even praising really good tries. That's great. Using rewards and privileges to reinforce good behaviors. So getting along with a sibling, completing school assignments, those kind of even smaller things. Some parents will say they're supposed to complete school assignments, absolutely, but that may not necessarily be a given during a heightened time of stress. And know when not to respond. You can do something called planned ignoring. Some people call it intentional ignoring. Ignoring bad behavior can be a really effective way of discouraging children from engaging in that. Using timeouts appropriately for the right age. 1 minute per year of age is usually a good guide. Praising them when they're done, and just this tool obviously works best for younger children. And then using a special time in. I love having a special time, and even with everyone home together 24/7, really set aside some special time with each child. It can even be 5 or 10 minutes. That's really powerful and something kids really look forward to. You can let your child choose the activity, even if it's just talking with your team about their day, alone, one-on-one. That means a lot to your child. Keeping cell phones off or on silent during that time so neither of you get distracted. And I love this this graphic. So, so I stepped away for like 2 seconds, and that was the beginning of every parenting horror story ever. And that was me when my child mixed 2 toxic chemicals while I was teaching them how to clean a bathroom. So that was 2 seconds. And I'm sure many of you have your own, and I wanted to stop here and open up for questions.
Okay, sorry, I had to unmute myself there for just a moment. Thank you. Okay, I'm ready to launch into some questions here. Let me just bear with me 1 second till I get my notes up. So, how can we have effective communication in our families so parents don't feel like they're shouting at kids in their bedrooms, or if we're having a lot of arguments and conflict with our kids? Could you talk about that a little bit? Because I can't believe that's not happening.
Yeah, it's definitely happening. And I hear it a lot. Even in my own home, we've had a lot of increased conflict. Everyone's home, so how can you not? You have multiple personalities and multiple needs all in one household, and everyone's kids are all competing for attention, and parents are pulled in many, many different directions. The whole family cycle is off. So, and I guarantee if you're having an argument with someone in your family, you've probably had that same argument many, many times before. So a couple of things that parents can do. Try to keep communication open and frequent. Use clear, really honest language of what your expectations are, what the rules are. Print them up. Make a kind of family house rules list of when cell phones have to go off, or how long people can have cell phones for. That seems to have been the biggest one I've heard about in these past few months. Try to use I statements. So they're not nearly as accusatory as saying, you never listen, or you always have your phone, or you do this. So making an I statement. It's more fact-based. So it's not putting assumptions on a person's behavior or the motives behind a person's behavior. Try to be an active listener. It's okay if your kids disagree with you in a respectful way. And listen to that. Maybe they have a valid nugget that you're able to kind of, okay, well, I'm willing to take that into consideration, and maybe we can collaborate and alter the family rules a little bit so you get your needs met, but we get ours met as well as the parent. Try to avoid blaming. That kind of blaming language is really unhelpful, and it immediately puts the other person on the defensive. I have loved setting up frequent family meetings. If you want to pick a day and time that works for everybody every week, that's fine. Let people know in advance when the family meeting is, so you're not shouting to come to the family meeting and getting angry when you hear your child say, in a minute. Wait to have that communication until everyone is ready. And if you as the parent or caregiver have done something that wasn't necessarily right, and maybe your team pointed that out to you, it's okay to apologize if that's warranted. Kids feel validated that way. They feel heard, and they feel that they are respected by their parent, and that really does build that mutual respect. And before responding, just reflect and pause on what your child said, or reflect and pause on what you want to say. Really feel infuriated as a parent. You might say something that could be damaging. Go outside for a minute. It's okay to say, I'm having some thoughts that I really don't want to express right now, so I'm going to go outside and calm down, and then I'll be able to talk to you more calmly. That's way better than getting into kind of the blaming and the yelling and the shouting. And if you as the parent, and then I'll be done with this for the next question. If you don't think that the person you're talking to, whether it's your partner or your child, is really listening with active intent, then you are really just in this battle mode. So it's okay to say, I don't feel like you're listening to me or bringing your attention, the most of your attention that I need right now. When you are ready, let me know and we will have this discussion.
Well, good luck with that.
Yeah.
That's a toughie. I do like the whole family meeting thing, though. It gives everybody a kind of an equal chance to have an opinion and be listened to, and let their time that they want to take to do that be respected. So I think that's a good thing in almost any circumstance, actually. Okay, I have a question here that's a bit lengthy, so I need to paraphrase it a little bit. So we're talking here about a child who's 9 years old. And basically, there's multiple diagnoses here. There's ODD, there's anxiety, dysgraphia. There's a whole bunch of stuff. What the mom is saying is that there's no support from school. In order to get there was a legal settlement, and they've agreed to class this child only as other health impaired, struggling with schoolwork. I guess the bottom line here is that she's not sure how to handle the child. He's very needy, will not, even, he doesn't participate, doesn't respect boundaries. There's so much going on here. I think this is a really tough question to answer or to consider in this environment, but I thought I would, make a stab at you trying to just kind of talk about this. Would you care to comment on that?
Sure. And I did, I have a number of resources in here. And for example, there's Lifeline is in any county by dialing 211. That really gets you some support for food, for housing, mental health, for legal needs, even in family utilities. So 211 is actually a nice resource that not a lot of parents know about. The crisis text line, so you can text connect to 741-741, and that will connect you with a live person, especially during periods of crisis. So if this child has ODD, so it's oppositional defiant disorder, where some of these, sometimes that can create a lot of a crisis situation in the home. And I don't know if it's gotten to that extent, but that is another option and resource for certain families. And a lot of therapists have switched their platforms to remote telehealth for therapy. So Psychology Today has a number of providers who are conducting telehealth sessions remotely, and that it's nice. You don't have to leave your house. You and your child could participate if that's deemed appropriate by the therapist. If the child is old enough to participate, him or herself, they will certainly attempt to do that. Sorry?
I was just going to say the mom just contributed another piece of information, and she said that we have in-home therapy now through the state. So
That's
maybe
great.
we'll see maybe there'll be some improvement with this, but it sounds like it's a really difficult situation to kind of wrap your head around.
Yeah, and if the parents can certainly, if they're getting in-home therapy, they can certainly work with the CMO and perhaps get some services through an organization like Perform Care. Well, they will come out to the home and assess the situation, interview the family, do an evaluation, be able to set up services in the home. So hopefully.
So that's a good move. Yeah. So question about COVID specifically. So this woman is saying that my mom died from COVID. She was in her 80s and not in good health. It has been particularly difficult because we could not visit her. So we're looking for suggestions that you may have how to manage this with the grandkids who are aged from 7 to 15. Any comments would be appreciated. So can you help out there at all?
And I'm so sorry to that individual. That has been a really traumatic consequence of this time, where people are getting sick and they're in the hospital or in a nursing home and cannot have any visitors, and they're really alone. And then And then, the added stress and grief of losing an individual to COVID. We have lost, I think, over up to 120,000 individuals in the United States as of today from COVID. And the reality is unfortunately, most of them have died alone, which is not something that we would ever want for our loved one. So it's the rituals that we would typically rely on to say goodbye, like having funerals or Shiva, or visiting a loved one in the hospital are not kind of happening right now, and people are really experiencing this collective grief. And for kids, that's really difficult because the whole construct of death and loss is somewhat interrupted to a degree by not having that closure, by not having the funeral, by not having that process to go through. And there's a couple of strategies that kids can use, or parents can use for their kids. New York University Langone actually put out a really nice piece on their news hub, and I loved it. I can upload it. So help under normal circumstances, as painful as that experience is of death, it can be helpful to remember your loved one. That's kind of a universal experience of remembering the loved one. So, and kids just all deal differently in the way they respond to death. So really, you kind of have to just meet the needs of your child and whatever they're feeling. Let them have a chance to talk about the person who died and their feelings about the death, to kind of normalize that experience. So sadness and longing are somewhat easy emotions to validate, but other emotions that can come out and do are like anger, including at the person who died, because I didn't get to say goodbye to grandma and grandpa. So that's really difficult and challenging to validate, but it's still just equally as important. So young kids may need some explanation about what death means first, but it is important to convey that it is a permanent state and that people can't come back from it. And it's somewhat, some research has indicated that it's preferable perhaps in the younger ages to use the word death instead of died, rather than other language like passed away. So using death or died as opposed to passed away, because that really leaves some room for confusion about what happened.
Okay.
I will post that up on it's a blog afterwards.
Oh, that's great. Thank you. Thank you.
Sure.
Any suggestions for walking the line between letting yourself off the hook and ignoring responsibilities?
I think they're really situation specific. So, and that's a tough question to answer. And I guess that the answer is somewhat, it depends. Ignoring certain behaviors, if every behavior serves a function for kids and for adults. When I procrastinate something, it's serving some function. Either I want to do something else that's more enjoyable, or I feel that the thing I'm procrastinating is too daunting and I don't maybe have confidence in myself that I can do it. Unconsciously or consciously, every behavior has some sort of function behind it. So I think trying to look at things that way is, why is my child doing that? Or why am I doing something as a parent? So looking at it from that perspective, is my child needing to get something out of this right now? And is it just that the behavior is kind of, the child understands what the rule is? So maybe the child's whining about something, or asking the same question over and over. That's okay to ignore. If you're confident that you have explained it and you've been clear in your language, it's okay to say, I am not answering that question anymore, and I will talk to you about something else, but I am not going to talk about this specific subject again.
It's kind of been asked and answered then, so you're done.
Yeah, and I think it's just it's a specific, but thinking about a person's behavior and what the function is behind it sometimes helps unlock is the key to unlock understanding, when to use that planned ignoring and when to let yourself off the hook. Some things it's like, okay, well, tonight I'm just not gonna, some of the rules are just gonna go out the window tonight, and that's okay. And you can even communicate that to your child. You can say, like, I had a really difficult day tonight. It's okay if you guys want to use screens a little bit longer tonight. We're not going to stick to the rule. It's okay once in a while to alter the rules, but generally trying to be as consistent as possible is preferred. And especially if you have a child who really thrives on consistency and rules and rituals and kind of a needing that planned routine. So that's specifically talking about kids who may be on the autism spectrum. Having that planned routine is really important. It's for some kids on the spectrum, it is really not wise to deviate from that.
Change, yeah. Okay, thank you. I'm concerned that my grandchild, who was struggling with school refusal issues before this pandemic, will be worse once school resumes, especially if he has to wear a mask or, won't be able to sit close to his friends, the kinds of things that are a possibility when school reopens. Any thoughts about that? Any suggestions?
Yeah, that has been a difficult one, because even with school refusal, often those kids struggle with social anxiety, or they could be experiencing bullying or rejection. It may not be active bullying, it may just be social rejection, which is a more passive type of bullying experience. And those kids have really struggled, because when you have a child with anxiety, their number one desire is to avoid that which causes them anxiety. So I'm anxious about going to the doctor and getting a shot, so I want to avoid going to the doctor. And the parent who then says, okay, well, we don't, not that a parent would say, okay, we don't have to go to the doctor, this is just an example, really reinforces that anxiety and reinforces it. So the next time you try to get your child to go into the doctor, it is going to be a huge mountain to climb. And that's really not what you want to do. And that population, the kids with social anxiety and the kids with school refusal, they are a really vulnerable population, with now having been out of the school system for what's going to be 6 months by the time school in September. So, talking about, slowly broaching that topic of, well, school is going to start in September. And if the child asks, well, maybe it won't, or maybe we won't go back, or maybe there'll be another wave and I won't have to go back, kind of reiterating that, no, school will start in September, because getting them used to it, that may not happen. Yes, there could be another wave, and there's a lot of, unknowns in all of this, but informing your child that the goal of the educators is to have the children back in school in September. So, kind of not giving into this, well, maybe it won't, and not letting things be nebulous. If it does turn out that kids don't go back to school, well, then, that is something we just can't know. But letting them know that is the plan. And you can also, like, for those parents, they can certainly reach out to their child study team and express their concerns. And some schools may have that flexibility to do something called preferred scheduling. It may not be perfect. It may not be exactly what you want. It's not like, ordering from a menu and getting exactly what you want. But you as a parent may be able to, if the child does have a diagnosis of, say, social anxiety or something else that's leading to this school refusal, a preferred scheduling is something where you can designate maybe a preferred peer, someone your child feels comfortable with, will have a more successful school experience, knowing that child is going to be in my math and in my lunch period, knowing that there's some bright spots throughout the day. But that is going to be a challenge for schools, because
I imagine so. Yeah. Could you talk about some opportunities for life skills learning for kids in this environment?
Oh, could I? Sure. A couple of things that I've heard parents are really successful with in teaching their kids. So for kids who are maybe more affected by an autism spectrum disorder, so that may be, spending some time where you're kind of, like I said in the beginning, wearing multiple hats. You're filling in the role for a behavior therapist. So you may be the BCBA in the home with your child, and have scheduled like behavior time. So today we're going to practice teeth brushing. So learning like hygiene skills, or teaching them how to prepare food and not just grabbing snacks out of the pantry or out of the drawer bin where there's, you know, yogurt or something that's already prepared, but just readily available rather, but just really teaching them how to prepare food, make a simple sandwich, a peanut butter and jelly sandwich, something that they can do themselves. Helping kids kind of develop in a safe way some choices for themselves. Help them develop this menu of options. You know, a lot of parents have been baking or teaching their child home safety, how to use the oven, you know, how to
clean the toilet. Probably one. Okay.
Not mixing the wrong kind of chemicals.
Yeah.
You know, help them think through ordering food. Like when you have dinner one night, you could pretend it's a restaurant and help them learn, think through, and practice ordering food in a restaurant. Letting them really practice these skills so when they're back out, they can really generalize those skills to other scenarios. So, and there's a lot of really good sites out there that are providing life skills learning options particularly for kids who are on the spectrum, but you know, this works for kids of all ages. Kids can really take the opportunity to develop a sense of agency of who they are and what they're able to do. And that one of the benefits is it really does help improve their self-esteem and their self-view.
And those are really actually very appropriate things for a kid to learn, you know, whether it's baking cookies or, you know, again, making a sandwich, being able to do something for themselves.
And then you could build it.
Which leads me, oh, sorry.
And then you could, you know, add on top of it, you know, we're going to make cookies and then that social component. We're going to deliver them to your friends' houses. You could just pick 3 friends in your neighborhood and get in the car, have them packaged up. If the other parent's okay with it, like you can come over and socially distance and just drop the cookies off or stay in the car if the other parent's uncomfortable with you getting out, giving them a bit of a social opportunity as well. So kind of two-pronged benefit.
Okay, great idea. We've gone, let's see, I think we have time for one more here. As a grandmother, I've noticed that kids want their parents to do stuff with them all the time. They don't seem to know how to entertain themselves these days. The shutdown situation seems to have made this much worse. And any suggestions on how to handle that situation?
Well, that's a problem that was happening before COVID-19. So
yes, yep.
Because this whole, I did not grow up with a cell phone. When I was growing up, cell phones were still kind of big and giant and usually only confined to the car for certain people like doctors. So we were not on screens all the time. But now, I mean, kids are, and I see 6-year-olds and 7-year-olds with smartphones and they are constantly on them. So that skill of being able to manage one's time effectively and age appropriately, so we don't expect a 4-year-old to entertain him or herself for an hour. But it is a really hard thing for kids to do because they're so reliant on a device for entertainment. So a lot of these skills of working out arguments and coming up with games and coming up with new rules for games are kind of going by the wayside for a lot of individuals in this generation. And you could ask social psychologists what the long-term effects of that are going to be. But I can empathize with this grandmother who says, you know, that the kids need kind of constant entertainment and where are we going? And there is this whole culture of being entertained. And today we're going to the zoo, or today we're going to the bounce place or the trampoline place. So it's always this go, go, go. So that is one benefit that I have actually liked from these past 3 months of you can't go anywhere. So let's figure out ways to entertain yourself. So bringing out old school board games and dusting off Monopoly or Scrabble. So maybe picking things that have some sort of hidden educational benefit like Scrabble, where they're actually kind of learning spell and letter recognition and those kind of things. And I think it's super important to build in family downtime where everybody and every individual of the family has to have their own space. That is going to help reduce the risk of parent burnout. You know, mom or dad, they get to go to their own, you know, space and just have a couple moments. And it can be scheduled throughout the day. So, you know, if it is so hard for kids to entertain themselves, maybe it's 4 blocks a day of just 10 minutes a block where, okay, now we're all going to go have quiet time. And that doesn't mean that someone's with you telling you, you know, what are we going to do next, or how are we going to play?
Yeah.
So I think that scheduled downtime throughout the day is really helpful, and you can start small and build it up.
It's interesting because I have another, I said that was the last question, but I'm going to jump to one more because it's kind of a follow-up to that. So I have a single parent with 3 kids, the age 6 to 10. And the parent is saying, I'm exhausted and I'm asleep soon after the kids are in bed. How do I carve out time for myself? So that's actually a great point based on what you were just talking about. And so schedule that downtime and everybody gets to go to their corners and you know, be separated for a little bit.
Mm-hmm. Yeah, and
Including the mom. That isn't the time where then you mop the floor and do the dishes. Maybe that's the time where you actually get your 20 minutes or whatever it is.
right. You almost have to like make a date with yourself. So some people look at exercise as something, well, they schedule it on their calendars. They don't let other work meetings or other things interfere with it. That's really important to them, and that's their special time. Other people just need time to sit and meditate. That's perfect. But kind of block it out in your calendar. Even schedule it on your phone so you know this is something you can look forward to. It's like a treat to yourself, and you deserve it. It is self-care. And letting your kids know, build it into the schedule, put it up visually. You know, call it whatever you want, but you know, and that is okay. But it's okay to let things go, right? Like you said, you know, don't worry about doing the dishes, or I can fold a basket of laundry right now. You know, that's okay. Your self-care time is more important.
Okay, I think we'll end it here. Dr. Theobald, thank you so much. That was a really good presentation, and it is a troubling time that we're in right now and frustrating. So you provided some good answers, so much appreciated. Thank you.
Thank you.